Okay, so welcome back to part 2 of chapter 1. We'll continue with the anatomical terminologies we have to know. So the last set of anatomical terminologies we will go over are the body cavities and the membranes that line them. The body's trunk is actually divided into 3 major regions: the thoracic cavity, the abdominal cavity, and the pelvic cavity, okay, or regions. So most of our vital organs are located within these regions, okay, other than our brain, of course, because our brain is housed in the skull right here. So most of your other very critical organs is mainly in the trunk of the body. So body cavities are defined as those that are closed, fluid-filled, and lined by a thin tissue layer called the serous membrane, or serosa, the serosa layer. So these are where these body cavities are areas where your vital organs of the trunk are suspended within these body cavities. So that's why a lot of times some of this structures is actually anchored to the body, either via ligaments or via the serous membrane that helps keep them in place relative to each other. Now, the body cavities have 2 essential functions. First is that they protect delicate organs from shocks and impacts. In a little bit, okay, not too much. Okay, if someone stabs you in the abdomen, the serous membrane won't do much. But I'm talking about, gliding across the wall or someone slapping across your chest. Those won't all of a sudden cause damage to your internal organs or shift them out of place, because you have those serous membranes or body cavities in there to help you protect them. And also, the body cavity itself is what permit those significant changes in size and shape of internal organs. A lot of these internal organs, whether in the thoracic cavity or the abdominal cavity, these are where organs are all the time changing in shape. Your lungs, for example, expands every time you breathe in, and then they will contract in size when you breathe out. Your heart is constantly beating every single day, so they're enlarging, contracting all the time. Your stomach in this region stomach is and the uterus, but stomach everybody has, and is one of the organs that can expand even up to 4 times its original size. So that's why you can have those people that can eat those 50 hot dogs in 15 minutes or something, because their stomach can expand into that size. So we have to have these capabilities or spaces within our body that enable these expansion of different organs within the trunk area. Okay. All right. So, a general term used to refer to organs within our body is called viscera. Okay. Viscera. So viscera means organs. Okay, so any organs, that we call it viscera. There are serous membranes that line inside of the cavity and also around the surfaces of enclosed viscera. Okay, so there's actually 2 layers when we're talking about serous membrane a lot of times. Okay, so, excuse me. All right, so serous membrane are not just, a piece of flat saran wrap that's wrapping around your organs, either lungs or heart, okay? They are actually double layered and enclose a small space between the 2 layers. The small space is what encloses a fluid called serous fluid. Serous fluid, it functions, and a very important function is to moisten the membranes, lubricate the opposite double membranes, the opposing double membrane, so they don't rub against each other or against other serous membrane. So that means it reduces friction between tissues and organs, because like I said, your heart is always beating. Imagine if every time you your heart beats, it kind of hurts a little bit because the heart tissue is rubbing against your lung tissue. So we don't want that to happen, and that's why we have the serous membrane to protect your organs from rubbing against each other. Or your lungs. Imagine your lungs, every time you breathe in, your lung is rubbing against other places all over your ribs, your vertebrae, whatever it is that is hitting, it's nice to have that serous membrane that prevents that friction that's involved every time it changes in size. These important organs inside the abdominal or thoracic cavities. Okay, so that's why the serous membrane is very important. If you, for example, if you won't have a hard time imagining the serous membrane, don't imagine a saran wrap, because the saran wrap is just one single layer wrapping around an organ. And, if you put a bit of water, for example, into a Ziploc bag, okay, that's more like what serous membrane is like. You put some little bit of water in a Ziploc bag, remove all the air bubbles, and try to wrap it around an object, and you will see what I mean, okay? So I'm actually going to show you that. So let me pause a little bit. All right, so this is what I was going to demonstrate to you. So you have a Ziploc bag, like I said, with the little bit of fluid in there to represent your serous fluid, and then the Ziploc bag to mimic your serous membrane. And let's say this little sweet potato here is your heart, for example. So here's this layer of serous membrane that's going to wrap around the heart, your organ. Okay, so you see how it wraps around, and it has these fluid in there to sort of lubricate around the object. And as you move it, okay, for example, if the heart is pumping, it glides around. The fluid inside is what allows the tissue to glide within. Okay, you see what I mean? So that's what serous membrane is. Okay, so I will discuss in a bit in the lecture that you have to make the distinguish between visceral part of the serous membrane versus the parietal part. Okay, so here's the organ, here's the serous membrane that wraps around it. Okay, so the layer that touches the sweet potato or the organ, the layer right here that touches the organ is the visceral side of the serous membrane. Remember, we said viscera means internal organs. Okay, so that's what we call this side, the visceral whatever serous membrane side. Okay, visceral serosa. Okay, visceral serosa right next to the organ, and then the outside right here that's either next to other tissues or the actual body cavity is then called the parietal serosa. Okay, outside layer parietal serosa. Okay, inside layer that touches the organ itself directly is the visceral serosa. Okay. So if you take this apart, you see that, this is a double membrane, okay? Two layers, okay? You have your parietal serosa and visceral serosa, along with the serous fluid that's within there that's going to lubricate and allow sort of that slippery movement between the two layers, okay? And you see, and the other thing I want to take a note of is that it's actually kind of hard to pull the two layers apart. And that's what you don't want to happen within the serous membrane anyway. There's a lot of different types of inflammation dealing with if the serous fluid was to get infection. It's actually going to expand this area and it's actually going to, stop the organ from functioning correctly if you have inflammation of the serous membrane itself or the serous fluid in there. Okay, so it's actually hard to remove these two from each other if you have emptied all the air pockets correctly from your Ziploc bag. So feel free to set this up yourself if you find that that's how you can remember, visceral versus parietal or serosa. Okay, so now that we have the basic definitions of what body cavity is and the serous membrane and know which side is visceral, which side is parietal, let's begin talking about these specific cavities and the specific type of serous membrane that wraps around major organs. So We'll begin by talking about the thoracic cavity first, which is the major cavity in the chest area above or superior to your diaphragm. It is further subdivided into your left and right pleural cavity. So here's another good word to remember for in terms of what does it refer to. Whenever you see pleural, that means lungs, okay? So these are the cavities where your lungs are residing in. And if it's a serous membrane that wraps around the lungs, we call it, visceral or parietal pleura. Okay, so remember, pleura usually means something to do with the lungs. And your lungs is actually separated by another mass of tissue called the mediastinum. Okay, so this area right here is the mediastinum that separates your left and right lungs. Now remember, we talked about what viscera refers to. They are your internal organs, and that serous membranes has 2 layers, as I've demonstrated. So the layer that covers and directly in touch with the organ is called the visceral layer, okay, or visceral serosa, whereas the outer layer that may be attached to the cavity wall is called the parietal layer or parietal serosa. Okay, so if you remember back from the the sweet potato demonstration again, you can rewind back to that area if you want to go over this stuff again. The layer, the part of the plastic Ziploc bag that touches the potato itself, that's the visceral part, okay? And the outer layer of that Ziploc bag is called the parietal layer. So now if we're talking about a layer that surrounds the lungs, the layer that actually touches the lungs is referred as to the visceral pleura. Okay, pleura for what surrounds the lungs. Okay, visceral for saying that is next to the organ itself. Okay. And then the layer that's on the outside of the lungs that's attached to your thoracic cavity wall, that is your parietal pleura. So in a sense, if we're talking about the lungs like this, okay, the lungs, here's your lungs, 2 lungs, and then here's that double membrane layer that goes around, okay? It's like a little air pocket that goes around, but it's not air pocket because it's filled with serous fluid. That's the double layer right there, okay? And this layer, okay, this layer right here, directly smack next to the lungs, is the visceral pleura, okay? Whereas this layer, the outer layer that's directly attached to your thoracic cavity, is the parietal pleura. Okay, so serosa is just the general term for all serous membrane, but if we want to talk about the serous membrane that surrounds your lungs, we call it pleura instead. Okay, but we still refer to the 2 double layers as visceral or parietal, depending whether it is next to the lungs, okay, directly touching the lungs, or attached to the body cavity wall. Okay, all right. Let me make sure it goes back to red. Okay. So the mediastinum, like I said, is that mass of tissue, okay, in the central region of the thoracic cavity. It's basically a mass of connective tissue that surrounds and stabilizes and support the esophagus, trachea, thymus, all those stuff in the central part of your chest area, okay, as well as major blood vessels and those that, especially originate and end at the heart is where the mediastinum is important for supporting with, because the heart, right on top of your heart, here's your heart. Okay, there's a big vessel called the aorta, and also superior and inferior vena cava that we'll talk about the different big blood vessels of the heart. Those are just vessels. They're like little plastic pipes, okay, that's bendable and flexible. So it's nice to have this piece of connective tissues that make sure they stay in place. All right. So the heart is also covered by a different serous membrane because the pleura is supposed to be for lungs. So you have a different serous membrane that surrounds the heart. And that serous membrane that surrounds the heart is called pericardium. Okay? Cardium. Cardio, anything card starting with that word, it means something to do with the heart, okay? Peri usually means something, the outer layer, okay? So that means outer layer of the heart, okay? So pericardium, okay? We'll talk about, we'll use these endo and myo sometimes a lot. Okay, so usually peri means on the outside, endo means on the inside. So these are those prefixes I was talking about that helps you remember what part are we referring to. Okay, so peri means something on the outside. So this is a layer that surrounds the heart. Okay, pericardium. And the visceral layer of the pericardium or visceral pericardium is that layer is right next to the heart. You see how this drawing here really does a good job of showing you that double layer of the serous membrane. The one right next to the heart is the visceral layer of the pericardium. The one outside of the heart, okay, that is, rubbing against your lung tissue or, or actually the pleura of the lungs, that's your parietal layer of the pericardium. Parietal pericardium. And what's inside again is not air, okay, or else that's not good, is actually serous fluid that allows for lubrication, okay? Air won't allow lubrication. It is that fluid in there that's going to allow for lubrication. Okay, so that every time your heart is beating against other tissue, we're reducing the friction of that heart tissue rubbing against other things. Okay, also the pericardium gives the heart space, like I was talking about, to change size and shape as it fills with blood and as it pumps out blood. We'll talk all about the heart and how it functions in AMP2, one of my, also my favorite chapter. If you have heard of a condition called pericarditis, it has to do with inflammation of this particular pericardium part of the heart, okay? And what happens is because this pericardium is only supposed to take up certain space that allows your heart to move. Imagine if the pericardium was swollen to like this, okay, where it's just filled with tons of fluid due to inflammation, okay, that is called, okay, cardiac tamponade, and that we'll learn about in MP2, where your heart in there is not allowed to pump properly because it doesn't have enough space. All that huge fluid within the pericardium is actually pushing pressure or putting pressure against the heart, okay, so that's why it's very critical that these serous membrane are functioning as they, what they should be doing versus, if something goes wrong with them, it can actually lead to something pretty serious. In this case with the heart, it's actually prevents the heart from pumping correctly, and your heart is not doing anything in pumping enough blood for the rest of your body. Okay. All right. So the next major cavity, okay, of the that we'll talk about is what's inferior to the diaphragm, okay? So, again, this diagram here just showing you how if you put a fist into an air balloon or something, that's a good example of how serous membrane is doing its job. So it's kind of like what I was doing with my demo of the sweet potato with the Ziploc bag. But I feel like a Ziploc bag is a better illustration of that lubrication part of it. Okay, so the next major cavity, like I said, we'll be talking about the abdominal pelvic cavity, which is what's inferior to the diaphragm right here. Okay, so this whole part right here is the abdominal pelvic cavity, and of course, it's further subdivided into abdominal versus pelvic cavity. The abdominal cavity is right here, and the pelvic cavity is just little tiny space, smaller space down there. So the abdominal cavity is lined by a serous membrane called the peritoneum. Okay, so different serous membrane that surrounds different things are of course called different names. Okay, so the one that surrounds the lungs is called the pleura. The one that surrounds the heart is called pericardium. And then the one that surrounds your abdominal area is called peritoneum. And again, the side of the membrane in contact with the cavity wall is called the parietal peritoneum. And then the one that actually touches or in contact with your internal abdominal organs is called the visceral peritoneum. And again, this peritoneum is what allows organs of your digestive system to slide across one another without damage. And organs within the abdominal cavity are your liver, stomach, spleen, small intestines, and most of your large intestines, as we have seen when we were talking about your abdominal regions and quadrants. And the last cavity, which is the pelvic cavity, is actually not lined by serous membrane. So you don't have to remember another name of serous membrane. There's only 3 you have to remember: pleura for the lungs, pericardium for the heart, and peritoneum for the abdominal part. And just make sure you know how to distinguish between visceral versus parietal, which I have talked about again and again, over and over. Okay? All right, so the pelvic cavity is not lined by serous membrane, and it contains a small amount of organs, which is your urinary bladder, various reproductive organs, and distal portion of the large intestine. For females, the reproductive organs are, of course, your ovaries, uterine tubes, and uterus. For males is the prostate gland, seminal glands, etc. Okay? All right, so let's talk about now the last 2 main concepts in this chapter: homeostasis and imaging techniques. So homeostasis is the ability to maintain a stable internal environment, and it is a very critical concept that allows for an organism to survive. When homeostasis is imbalance, that's when we will feel sick, okay, and may result in a clinical condition that needs medical intervention. So whenever we don't feel well, something is painful, something is not right, probably your body is not able to maintain homeostasis somewhere in the body, okay? But not every time that our body is out of balance, we have to rush ourselves to the hospital, or else, we won't be able to do anything else. We'll be going to hospital every single second because our body is constantly changing. We're in the environment we're in is constantly changing. We would be nice and warm in the inside. The moment we stepped outside, to the hot sun, it will be even hotter. Or when we, sort of walking around Costco and going into the cold room, we'll be very, very cold all of a sudden. So all these different environmental changes externally, we have to make sure our internal body is not affected much by what we're exposed to on the outside. Okay, and that's what homeostasis is about. Okay, keeping the balance within the body itself. Okay, so under normal conditions, our body actually does a lot of the balancing for us on its own without us, consciously being aware of it. Our body does a lot of the work for us. Even when we're sleeping, there's something going on with the body that's doing something. Okay, so this is called homeostatic regulation. Okay, and it involves 2 general mechanisms. Okay, one is called autoregulation, which is a process that occurs when a cell, tissue, organ system adjusts itself in response to some environmental change. It doesn't require any external signals, okay? The cell itself knows what to do. So for example, if oxygen level was to decrease in a piece of tissue, an area of the body, the cells within that area would be able to sense that lower oxygen level, and they will release chemicals that can dilate blood vessel called vasodilation. Okay, that's something we'll talk about a lot about in AMP2, vasodilation. And When your blood vessel, increases in size, that's what dilation means. It will increase blood flow and provide more oxygen to that area and recover and bring your oxygen level in that localized area back to homeostasis. Okay, homeostasis, bringing things back to stable internal environment. Okay, so that's what we mean by autoregulation. It doesn't require any signal from anywhere else. The cell, tissue, or organ itself knows what to do. Okay. The second mechanism is called extrinsic regulation, which is a process that results from activities of the nervous and endocrine system. Now we need signal coming from somewhere, okay? These signals are what's going to detect environmental changes and send either electrical signals from your nervous system or chemical messengers like your endocrine system in forms of hormones to control or adjust activities of other systems simultaneously. Okay, like I said, your organ systems can't talk to each other, and sometimes you need multiple organs to coordinate with each other at the same time in order to achieve homeostasis. And in order for the organs to talk to each other, quote unquote, we need the help of the nervous system or the endocrine system. So here's a specific example. When we exercise, or run on a treadmill or something and walk outside in the neighborhood, your nervous system will increase the heart rate, okay? Because now that you're working out, you need more oxygen to be going towards your muscles, okay? So that increased demand in oxygen, you need to provide that by breathing harder or your heart pumping faster to get the blood going faster, delivering oxygen faster to your muscle cells. So when your nervous system tells your heart to increase its heart rate, blood will circulate faster and it will reduce blood flow to less active organs, for example, like the digestive tract. Okay, this is why when we are in need of, running around or doing something that's strenuous, usually at the moment we're not thinking about hunger. Okay, because things are, our brain is more towards helping ourselves to deal with the stressful situation versus eating. Okay, we'll talk about sympathetic versus parasympathetic nervous system at the end of the semester that has to do with that coordination. Okay. Now, so the nervous system will reduce blood flow to less needy organs while making sure oxygen is available for the actively moving muscles, for example, when we're exercising. Okay, so that's what's called extrinsic regulation, something that involves signals, hormones, neurotransmitters, nerve electrical signals that activate a response. Okay. All right, so every organ system we will talk about in AMP2 has both autoregulation and extrinsic regulation. Hence, this is why we introduced these two concepts in this first chapter. Okay, so each homeostatic regulatory mechanism consists of three things, okay? Receptor, control center, and effector. So receptor is a sensor, okay? So a lot of students get confused between receptor and effector tissue. Receptor is what recepts the signal, okay? So it's some kind of sensing thing, okay? That is sensitive to a particular stimulus or environmental change. Control center is what will receive that sensory information and process that and then sends out the correct commands or appropriate commands in response to the receptor sensory signal coming through. And then your effector is usually a cell or organ that respond to that particular command, okay? So that means usually the control center is your brain, okay? Something you sense with your fingers, okay? And then it gets sent to your nervous system, and then it goes right back out as a command to do something or move in response as your effector tissue. So it's kind of like you sitting in the room listening to me talk, but if all of a sudden someone opens the door and you hear that crack in the opening of the door, so that crack, okay, is the sensory information of sound coming through to your ears, and then it goes to your brain to tell you, hey, someone's opening the door, because I can hear the door cracking open. And then your brain then will send out a signal, ooh, I'm curious to know who just came in. Okay, so your brain sends out in a command to your effector tissue, such as the muscles of your neck, that will make you turn your neck towards the door to see, hey, who's that just walked in and opened your door. Okay, so that's how you can remember receptor, control center, and effector. Receptor was your ears listening to sensory information coming through, so it's got to be something that senses touch, vision, smell, okay, your 5 senses of the body. Okay, and then control center is usually something in the brain itself. For now, you don't have to know specific parts of the brain, but the brain is usually what receives those signal and then sends out the correct signal to effector tissue, something that does, act or move in response to that sensory information coming through. So if you hear a crack in the door, your effector tissue is your neck muscles that will turn your head toward the door to see who walked in. Or if you think about smelling yummy cookies, okay, you smell yummy cookies coming from the kitchen. That's sensory information coming through to your nose, which is your olfactory organ. Okay, so that's a receptor. Control center is your brain sensing, ooh, that's a smell of yummy cookies. And then effector tissue could be your salivary glands, which makes you salivate, or your muscles, okay, which tells you to get up and walking to the kitchen so you can have a bite of that yummy cookie. Okay, so don't mistake between receptor and effector. Okay, I will ask these kind of questions on the exam in terms of identifying homeostatic regulatory mechanism parts, okay? Because it is a major concept when we talk about homeostasis, is what are the receptor, what is your control center, and what is the effector tissues doing. And as I have mentioned, when things like body temperature, blood, or blood pH or blood pressure moves out of balance, and our body can't fix it automatically, because technically speaking, we have auto-regulation and extrinsic regulation that does things for us automatically without us, being aware of it. It happens on its own. But sometimes we, whatever that change is, can overwhelm our system, can overwhelm our body. And if our body can't fix it, then we will feel sick as a result. Okay, so that's why when we have a fever, okay, above your 37 degrees Celsius, that's when we feel very, ill and not well, don't want to do anything, have a headache, all that stuff is due to that imbalance in body temperature. I'll talk about blood pH, okay, in second chapter a little bit, and how when we have too acidic condition or too basic conditions, our body doesn't like it too, because a lot of our cells has very pH sensitive enzymes that works at certain pHs. So our blood pH cannot be above 7.45 or below 7.35. It's actually between a very, very stringent range. I'll talk about that in chapter 2 a little bit, and then immensely when we get to AMP2. There's a whole chapter on fluid electrolytes and acid and base, and what happens to your body if it gets too acidic or too alkaline. Okay? All right. So, of course, blood pressure. If we have too high blood pressure, too low blood pressure, that's not good either, okay? Too high blood pressure, it can actually damage our blood vessels in the long run. Too low blood pressure, we can actually faint, okay, and feel dizzy. So we have to maintain these things at that constant homeostasis imbalance. And this is why we have something called negative feedback. Negative feedback is what we refer to when we Negative feedback is what we refer to when we're asking mechanisms, talking about mechanisms that always brings the body back into homeostasis. Negative feedback always negates change. If it's too high, negative feedback is going to lower it back in balance. If it's too low, negative feedback will always increase it back to balance. Okay, so remember what negative feedback means. Just because it's called negative feedback, it doesn't mean it's always lowering something. Negative feedback, think of it not as lowering something, but always bringing things back into balance. It can be increasing something, okay, if things are too low. It's always bringing it right back to be in balance. If it's too high, it's going to bring it right back. If it gets too low, it's going to bring it right back into balance of the body, okay? All right. So this is your first exposure to what's called the homeostasis flowcharts. We will have a few of these this semester, but next semester in AMP2, we will have a gazillion of these because that's what all the organ system is doing for us. And all those different organ systems we'll be studying in the second semester is to maintain homeostasis. So that's why there will be a lot of these homeostasis chart you will see in the second semester. So make sure you kind of know and work your way around these homeostasis chart when we bring them up periodically in this semester. So these homeostasis flow chart tells us what happens when something is either too high, okay, or when something is too low. And what are the three parts involved in balancing mechanism? The receptor, the control center, and the effector. What does each of them do? What will they activate? So for example, in this particular negative feedback, we're talking about body temperature homeostasis. So if your body temperature rises above 37.2 Celsius, your receptor, which is your body temperature sensor, will be able to tell that sensory information to your brain, particularly the hypothalamus. And like I said, the hypothalamus does a whole range of stuff for us, okay? Other than endocrine organ hormone producing, it does thermal regulatory stuff too, okay? So that heat information is coming to your hypothalamus. Hypothalamus then sends a command to your effector tissues, such as your blood vessels or your sweat glands in the skin. Okay, what it will ask the blood vessels to do is ask for vasodilation, make your blood vessels bigger to increase blood flow. And that's why when we're hot, we look more red. It's weird if someone's very hot and they're looking pale. Usually when we're hot, we look pink and red on our face. That's because of systemic vasodilation. It's our body's way of irradiating that heat out, okay, to reduce the heat in the body. Increase sweating, all that water coming out on your surface of your skin is going to absorb that heat and take away that heat for you. So all that stuff that's happening will bring your body temperature back down. Now, if it's the opposite, if your body temperature is too low, below 36.7 degrees Celsius, again, your receptors are your body temperature sensors telling your hypothalamus that, hey, it's getting cold, you better do something about it. So the brain then sends out the command to, again, your blood vessels, sweat glands, and your skeletal muscles. Your blood vessels will now decrease blood flow. You do what's called vasoconstriction. Okay, vasoconstriction, which keeps the heat of the body to the core. Okay, that's why we tend to look more pale or starts turning purple if you're really, really cold. Decrease sweating, of course, because when we're cold, we want all the heat we can. So we don't want heat to escape from water on our skin. And shivering. That's what skeletal muscles do, and that's why we shiver when we're cold. Not because that's just a reaction, but it's because there's a purpose to that. Your muscles shivering and moving and contracting in very quick, cycles is what's going to be able to generate some heat for your body. Okay, so all of those three things, effector tissues, will then bring your body temperature back up. So that's how you read these homeostasis chart. There will be homeostasis chart for calcium ion concentration. We'll talk about when we get to the bone chapter, and then a lot of different stuff, water content, salt content, when your blood pressure goes up, blood pressure goes down, what happens, those are all what we're looking at in the second semester. Now, with the fact that we have negative feedback means we also have positive feedback, okay? But don't think, again, positive feedback is something that's increasing. So if we're increasing something to bring it back to normal, that's positive feedback. No, that's not the case. Okay, so don't confuse positive feedback with negative feedback. Negative feedback is bringing it back to balance. Positive feedback, on the other hand, is not negating change, but enhances and increases the change that was triggered purposely. Okay, because usually our body wants things to be balanced. Okay, so there are a lot more negative feedback mechanisms than positive feedback mechanisms. But sometimes there are situations where we do need enhancement of things, and a lot of times these situations usually involve something that is more potentially dangerous or stressful for the body, that your body must have something done quickly enough in order to restore homeostasis. So one good example of a positive feedback that we're relying on is blood clotting. Okay, so when an injury occurs and a blood vessel is cut, blood will rush out of the cut. It is a dangerous situation if we keep bleeding nonstop. So we need a positive feedback mechanism that will quickly enhance and close up the wound and the cut. Okay, so this process involves cells called platelets. And if we're just relying on one little dinky platelet coming to the cut spot, and then another, if it happens to pass by, because we don't have a lot of platelets in our blood, but if one happens to pass by, then it goes in the cut. Another one happens to pass by, goes in the cut. It will take forever. We would probably bleed to death before the platelet starts covering up that spot. So that's why we need this positive feedback for platelets to quickly react to a cut. Once one platelet binds, it releases chemicals that attract other platelets to bind. Okay, and then once you have 10 platelets, all of those 10 platelets are releasing signal, hey, we need help here, we need to close up the wound. Okay, let's gather all the soldiers in the fight. Okay, so all the platelets come around and then start sticking all over that open cut, eventually creating a blood clot that would very quickly close up the wound. Okay, so that's what that positive feedback is doing. It's enhancing that reaction of platelets recruiting more and more and more to come together to close up the wound and restore the homeostasis of your blood circulation, and you're not bleeding to death. Okay? All right. So another good example of positive feedback is labor and childbirth. Okay? So for labor and childbirth, there are hormones that cause uterine muscles to contract, okay, therefore able to push the baby out of its mother's body. Okay, so that positive feedback is triggered by the pressure of the baby's head pushing against the cervix. As the uterine contraction are squeezing down on the baby pushes the cervix a little harder, okay? And that pushing or pressure on the cervix will cause the release of hormones, specifically oxytocin from your hypothalamus, and then that would trigger your uterine contraction to intensify. Okay, so those, the oxytocin hormone, okay, which is, triggered by your nervous system from your cervix, okay, your cervix senses that pressure, sends a signal to the brain, control center then tells your part of the brain that releases oxytocin goes into circulation, gets to your uterine muscles, and uterine muscle then will intensify the rate and duration of its muscle contraction. So the more the baby pushes against the cervix, the harder the uterus is pushing for the baby to come out. Okay, so that's why this is an intensifying and enhancing cycle that allows for the baby to be pushed out. Okay, and oxytocin is not created by hypothalamus. It is actually made by your pituitary gland. Okay, pituitary gland. So, and once the baby is out, then everything returns back to homeostasis. Okay. All right, so here's a few or two practice questions that we will put homeostasis and into practice, and then identifying the three parts of the mechanism. So in this first practice question, a person has been in an auto accident. He has lost many pints of blood, and his blood pressure has fallen from the normal range of 120/80 to 90/60. Receptors in blood vessels send impulses to the brain that blood pressure has fallen, something that we're in trouble. So that his hypothalamus in the brain sends nerve impulses to the heart to beat faster and pump more blood. So here are the questions. What will happen to his blood pressure now, okay, after the hypothalamus has sent out a signal? Blood pressure will go back up. Try to maintain that homeostasis blood pressure as much as it can. Even though the body is bleeding, it's trying to do its best though to bring the blood pressure back up. So is this a positive or negative feedback? It's increasing blood pressure, but it is negating change. It is bringing blood pressure back to normal, so it's negative feedback. What are the three components of the homeostatic mechanism? So let's go with receptor. What are receptors? Well, it says it right here. Receptors in the blood vessels. Okay, so those are the receptors that tells your brain that your blood pressure has fallen. And hence, control center, the hypothalamus or the brain, okay? And then the effector is your heart, okay? Your heart now beats faster to pump more blood, okay? So receptor, blood vessel, control center, brain or hypothalamus, and then the heart is the effector. And lastly, if not controlled by homeostasis, what will happen to his blood pressure? Of course, it will just continue dropping and dropping until, it no longer is enough to keep the person alive, okay? All right, second practice question. A mother has just given birth to her baby, and she was told that she have to allow the baby to suckle on her breast in order to produce milk. When the baby suckles on a woman's breast, it promotes the production of prolactin in the mother by signaling the hypothalamus of the brain. The more often she breastfeeds, the more milk she will produce. Is this a positive or negative feedback? The more often she breastfeeds, the more milk she will produce. So it's not really bringing things back to the middle. It's enhancing something. Okay, so it's positive feedback. What are the three components? You have let's start with the receptor. What's a receptor? What is triggering or stimulating the woman's body to make more milk? The baby suckling, which means it is the skin around the nipples. Okay, so that's the receptor. Okay, receptor, the skin around the nipples, probably the areola part of the the nipple area. Okay, so there are tactile receptors within that skin around the nipples that senses pressure, and that pressure again is going to send a signal to your hypothalamus, and hypothalamus then sends the commands back out to your mammary glands. Okay, so control center is your hypothalamus, okay? Effector then is mammary glands, because that's what produces milk, okay? So that brain tells your mammary glands, hey, the baby is sucking and needing more milk. We need more supply, okay? So the effector tissues are your mammary glands that is going to act in response by making a lot more milk to provide for the baby's needs, okay? So last question, if the baby slowly decreases his time on breastfeeding, what will happen to the mother's milk production? It will also decrease, okay? Because you have no stimulation, less stimulation, then less command is going to come out from your hypothalamus, and it will stop the stimulation of the mammary glands in milk production, okay? So this is a positive feedback, enhancing production. All right, so And we will finish this lecture by going over the 5 main types of diagnostic imaging techniques. So we're finally at the last main point concept of the chapter. Know that this is supposed to be a 2-hour lecture and sometimes even longer. So even when we are in actual class setting, if we don't finish that chapter for that during lecture time, we will continue in lab actually, because a lot of the labs actually don't take up the whole 2 hour. So know that every single day you're supposed to be spending a good 2 hour of lecture and 2 hour of lab, or altogether 4 hours on lab and lecture together. Okay, this is for the summer. For the fall and spring is actually even more, 2 hour 40 minutes for lecture and another 2 hour 40 minutes for lab. So that's why these chapters seems long, but if we're talking about in class setting, that's how much time we're spending talking about the topic. So make sure you're spending the same amount of time in going over these concepts, okay? So diagnostic imaging is what allows a doctor to look inside your body for clues about a medical condition. Okay, so a variety of techniques are used to create pictures of structures and activities even inside the body so that we can sort of see inside the person without cutting them open. Okay, because it's a big trauma to the body whenever you cut a body open to look at something or replace something. So before we even get to that stage, we can actually look through the imaging first to see what's going on before we cut a place open to see, or sort of minimize the location of the cut to where the person is injured or having problems with. And the oldest and most common method of diagnostic imaging, of course, is X-ray. Okay, so this technique uses ionizing radiation that goes through soft tissues of the body while it is absorbed by dense tissues like your bones. For soft tissue, it just goes right through. This is why our skull or vertebrate bones always shows up very nicely on X-ray images, because bones are a lot denser than our skin or fat tissue. So that's why we will see very clearly how our bone is shaped like through X-ray images. So the common use of this technique or X-ray is to visualize bones. And if we need to visualize some soft and hollow tissues, sometimes a radiopaque dye can be added to the, or ask the patient to drink something if we're looking at something that's in the digestive system to enhance the image, like this barium contrast X-ray of the upper digestive tract here. Okay, so this really dense area doesn't mean there's bones there. There's actually that radiopaque dye that enhances that really contrast between this upper digestive tract versus the background soft tissues. Okay, so the pros of X-ray is that it is cheap, easy, quick, non-invasive, and good for guiding instruments like catheters or stents. Cons, of course, is the radioactivity. Okay, radioactivity is still radiation, and radiation can cause cancer. And not that every time we go to X-ray we just increase our cancer likelihood. That doesn't happen. Okay, but we're talking about chronic exposure to radioactivity is when it gets increases your likelihood of cancer. And also with X-ray we only have limited vision of soft tissue, but just any type of radioactivity sometimes we don't want. So that's why that's a con of X-ray. So the rest of the techniques requires the help of a computer. So these are called scanning techniques, where the computer will render an image for us to visualize softer tissues of the body, because X-ray only shows good dense tissues like the bones. But sometimes we want to look at other parts of the body that's organ oriented as well. So that's why these other scanning techniques was invented and discovered to help us look at those softer tissues. Okay, one of those is called computed tomography. We all know pretty well that's called the CT scan. It involves a single X-ray source, so still radiation, but is a single X-ray source that actually rotates around the body multiple times. And the computer itself will combine those multiple X-rays, taken at those different angles, and produces images of cross sections of the body. So that's why it's not just smack two-dimensional of your skull or bone, it's actually, sort of give you that whole image of your three-dimensional body because you have this X-ray source that rotates around that area. Okay, so common uses are for softer tissues, internal organs, more detailed bone, textures and surfaces, blood flow even, we can see with CT scan, and data can actually be used for 3D rendering, which was what I was talking about because it's a moving X-ray source. Computer can actually take those multiple angles and make it look like, three-dimensional image of the person. The pros is that it's easy, quick, non-invasive. Cancer, you can actually see some cancer cells and good resolution of tissues of different densities, softer, denser ones. We can see them all, most of them anyway. And the cons is, of course, cost. Okay, so with all these scanning techniques, you will see cost is a common problem because now it requires a more expensive machine. There needs to be a computer there to render these images. So that's why the costs are higher for these type of techniques. And for CT scan, you're still using an X-ray source, so there is still radioactivity. Magnetic resonance imaging, or MRI, uses a powerful magnet, a very super powerful magnet, almost 3,000 times as strong as the Earth's magnetic field. Okay, so the purpose of the magnet is to line up all the protons in our body in one uniform direction to begin with within the magnetic field. So the magnet turns on, okay, have this huge magnetic field around the body, lines up all the protons in your body, and then radio waves are pulsed through the body to stimulate those protons, and they move out of equilibrium due to absorption of that energy. Okay, so then when radio waves are turned off, your MRI sensors are able to detect the energy that is released as the protons realign with the magnetic field once again. So it's kind of like having these magnets to orient everything in one direction, and then we're interrupting those equal uniform direction with radio waves, and then when those protons go back into their original position, that's what the that's what creates that change in energy and what the MRI will detect. And that absorption and release of energy is what will create an image for us on the computer screen with an MRI scan. Okay, common uses is we use MRI to view blood vessels, very beautiful images of blood vessels, big blood vessels anyway. If we're talking about blood vessels of the heart, sometimes we require angiography, and we'll talk about that in AMP2. But, there's blood vessels, and also for bones and joints as well, we can use MRI to scan spinal injuries, soft tissues and organs, tendons, ligament tears, etc. Now, pros is that, again, it's non-invasive. We're not poking anything into you or asking you to drink anything. Differentiate between normal and abnormal soft tissues at the highest resolution. And of course, the cons is the cost. Okay, MRI is very good, but it is usually very, very expensive if it's not covered by insurance. Okay, out-of-pocket costs are anywhere in the thousands area for sure. And then it can actually have an effect of metal in the body because we're relying on a magnet. And then, if you have, metal implants, then you can't do an MRI, okay? But I think there are other, now better technologies where we can use, things that are not going to affect MRI scans. But, that's something outside of the story. Okay, so MRIs can be noisy too. Sometimes patients don't like that. It requires absolute stillness. Some people feel claustrophobic inside the little MRI area. And it may require some sedation if, a patient is really feeling uneased about the whole thing. Because you need to sit, lie there very still for MRI to happen, and sometimes you can be in the MRI scan for quite a bit of time. When I did it for volunteer experiments. Okay. I was actually in there for like a good 20-30 minutes. I almost fell asleep. But yeah, that's what MRI is. But it produces beautiful images in the end without giving you any radioactivity. It's just using a magnet. All right. And then you have positron emission tomography, or the PET scan. It is an imaging technique that can assess metabolic activity by using glucose molecules with radioactive carbon. This is the only type of imaging that can give you some kind of live activity feedback. Okay, so it not only collect information about anatomical structure of the organ, but also the physiological function of the organ, such as metabolism. So sometimes we can detect physiological changes a lot sooner than anatomical structural changes, like in the case of cancer. So that's why small amounts of cancer cells can be seen on PET scan, because they're rapidly undergoing metabolism for that very quick growth. Okay, so sometimes when we're just talking about small little groups of cancer cells, we'll never be able to detect that on CT scan or MRI scan. It's not an actual tumor where it's a large mass of tissue yet, but it's just specks of cells here and there that are starting to metabolize and form colonies of cancer cells. So this is when they are more visible on PET scan. Okay, so common uses for, usually other than cancer, is for detecting brain changes, okay, and also heart conditions. Pros is that, they have, of course, provide that detailed look and metabolic, like I said, that live activity assessment of the body, of that particular organ or tissue. Now, real-time information can actually be gathered as we're looking at what areas of that organ is flashing to show that there's a lot of metabolism in those areas. For example, in the brain, a depressed brain, you will see very little activity, whereas a non-depressed brain, you will have a lot of different activity going on in the brain. The cons is, of course, I think it is the highest cost, if I'm correct. Compared to MRI or CT scan, because I remember my mom's insurance won't cover PET scan unless it is for sure she has a second round of cancer that she needs to detect cancer cells again. So I'm pretty sure PET scan is more expensive than CT or MRI. It involves some radioactivity because you're using some radioactive element to detect those changes. It can be claustrophobic as well, because you're still laying on that little bed that moves into this donut hole for imaging, okay, and may require sedation. And the last type of imaging technique is ultrasound, or also called sonography. Some of you may be thinking about that as a career, okay, as a diagnostic ultrasound sonography technician, okay. So this type of technique is really relying on high frequency sound waves, not radioactivity, not magnet or absorption and release of energy, but sound waves. That these sound waves are emitted from the ultrasound machine, and then they're reflected by internal structures in echoes. And those echoes collected by the sensor is what creates an image. So the common uses for ultrasound is for fetal monitoring, okay, for heart monitor, blood vessel problems, thyroid problems, or abdominal pelvic organ problems. So also ultrasound is commonly used to look at heart functions, where we're looking at heart valve opening and closing to see whether the valve is working as it should. So you will see people doing chest sonography for heart problems. Some pros of sonography, of course, is non-invasive, easy, and cheap at the same time. And it provides some real-time information, can also produce audible sounds, because now we're talking about listening to those echoes. So that's why this machine also collects sounds. That's why we can hear blood flow, or the flopping of that blood, the heart valve closing together. You'll hear boop, 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 and then that little sound of the valves closing together. And then you have, and you can hear heartbeat as well. Okay, heart flow, heartbeat. in the body or the fetus. Okay, so cons is the limited visualization of some tissues, limitation of for morbidly obese patients, because you're relying on these sound waves. The more cushion it has to go through, or layers of tissue it needs to go through, the more obscured that image will be. Okay, and sometimes it may require some kind of probe insertion into the area for a better image. Okay, so this wraps up chapter 1 as an introduction to anatomy and physiology. Let's go over the practice questions and we will be done. Okay, so at which level of organization does a histologist investigate structure? Histologist, so tissue. Okay, if it's cellular, what should it be? Cytologist, right? So cytology and histology, the two subdivisions of microscopic anatomy. Okay. Oops, excuse me. All right, so which term below are mismatch? Liver abdominal, lungs plural, stomach pelvic, bladder pelvic. Stomach doesn't belong in the pelvic cavity. Stomach is in the abdominal cavity, okay? When the body is in the correct anatomical position, what does that look like? C, hands are at the sides, palms facing forward, feet together, eyes straight ahead. The standard reference of anatomical position. Bruce has gallbladder problems. Where does Bruce have pain? So here's that, on the exam, you're not going to get this image where all the organs is. So make sure you know where the gist of these organs are in this image. And here's the gallbladder. The gallbladder actually sits behind the liver like this in the little pouch area. Okay, so in that particular region, what is best to describe where the gallbladder sits? Well, epigastric is right here, but there's parts of it in the middle. Left hypochondriac is right here. That's not where the gallbladder is. Right lumbar region, which is the middle, that's not where the gallbladder is. So the best description would be the right upper quadrant. This whole area is where that gallbladder is. The blank peritoneum surrounds the organs, and the blank peritoneum lines the what? This membrane functions too. So the one that lines organs directly is visceral, okay? Then the parietal peritoneum lines the abdominal cavity. This membrane functions to allow organs to slide across each other. So that's the importance of serous membrane that I talked about. Which type of section would separate or divide the body down the middle between the eyes? Okay, remember the between the eyes. So here's a person, eyes, nose, mouth, right there. Okay, so mid-sagittal section is going to cut right in the middle. The pleura is what to the pericardium and blank to the diaphragm. So imagine, here's your lungs, here's your heart. Okay, so pleura is what surrounds the lungs. Pericardium is what surrounds the heart. So pleura is to the side of the pericardium, so it's lateral, and both are, here's your diaphragm, before your abdominal cavity, so it's superior to the diaphragm. Contents of the thoracic cavity include the blank, heart and lungs, thoracic, the chest area, heart and lungs, and then it's further subdivided into your pleural or pericardial. This surrounds the lungs, this surrounds the heart, okay? Liver and stomach is your abdominal cavity, okay, and it doesn't subdivide into different cavities, okay? All right, why is homeostatic regulation important to an organism? Physiological system can function normally only under carefully controlled condition. Controlling stable internal environment is the key word for homeostasis. Blood clotting is an example of positive feedback. We are enhancing the recruitment of platelets to the cut. Okay, body temperature is an example of negative feedback, bringing it back to homeostasis. Okay. All right, and that's all for chapter 1. I will see you in chapter 2.